Daryl, it's very nice to have you here. I was thinking about introducing us for starters, and then we go on to the interview. So, Daryl Mahon is an Irish psychotherapist, lecturer, and researcher. And you took on the task of reviewing deliberate practice evidence. In 2022, you published in the article A Scoping Review of Deliberate Practice in the Acquisition of Therapeutic Skills and Practice. I've seen this also referred to as a 2023 article. It was formally published in 2023, then pre-published in a way in 2022. Is that right?
Yes, that's correct. I think maybe the 2022 citation is from when it went on early cite.
Okay.
And then when it went into the journal, it would have been 2023. Yes, so little minor discrepancy.
Great, great. This article is the first of its kind, and it's considered an important overview over the empirical status for deliberate practice in psychotherapy. And very, very recently, I don't know how many weeks ago, but there was published another review on DP evidence by Nurse and colleagues. This is a 2024 article, and I very much recommend reading both of these to get the overview of the evidence status. So Daryl Mahon has 15 years working across human services as a practitioner, manager, researcher, and in academia. He has previously held the role of Assistant Academic Director, Human and Social Sciences, with a focus on psychotherapy. He is an active researcher and has a range of publications, including academic textbooks, the last year, right? 2023, yeah, and journal articles. One of his areas of expertise is in psychotherapy outcomes and processes and deliberate practice. That's Daryl, and you're now in Ireland, right?
Yes, that's right, Peter. Yeah, I'm in Ireland.
Great.
Wicklow, Ireland.
Great. And my name is Vidar Husby, and I'm a psychologist, and I'm in Oslo, Norway. I'm with the International Deliberate Practice Society and Favne Psykologbistand here in Norway. I'm a DP supervisor, and very interested in this topic. And I've been really looking forward to talking about this DP research with you, Daryl. So let's jump to the first question. We start off easy. I think when I read your article for the first time, I didn't know, I hadn't heard about scoping review. What is a scoping review?
Good question. They are often mistaken for systematic review, or because I guess they sit within the realm of evidence synthesis. So in that sense, they are very similar to a systematic review. I guess probably the one main difference between the systematic review and the scoping review is the quality appraisal of included studies. Scoping reviews don't necessarily, well, they don't look to draw overall conclusions about the effectiveness of a intervention or approach, and therefore it's not always recommended or necessary to do quality appraisals. The other main difference would be that the scoping review has a much broader question to it. So maybe if we were to do a little comparison with the Nurse 2004 study that came out quite recently, now I haven't delved right into it, I'd have given it a bit of an overview. The key difference there is that I was also looking at maybe some of the implementation factors or challenges that would go along with DP in the available studies that I included and that I assessed and explored. So from a scope and review perspective, you can look at really any aspect of a study, from the journal it's published in to the year, to various challenges that are faced to the different countries, and they can be included sometimes in a systematic review as well. So probably one of the key differences is that there's a quality appraisal of studies and you're looking specifically at effectiveness.
Okay. Okay, so can you tell us a little bit about how you go about to do a scoping review?
Yes, I guess it's very, very similar to a systematic review insofar as you would follow the PRISMA
Yeah.
guidelines. So you would have a question in the scope and review domain. It's generally a broader question than a
Mm.
systematic review. So you would follow the Prisma guidelines. So your search strategy would have certain inclusion and exclusion criteria. You would use certain keywords. You would do a database search of several databases. You would do a bibliography search, and you would also look for maybe any grey literature, but that would be back to your inclusion criteria. For the specific piece that I done, the inclusion criteria was both grey literature and empirical studies that were peer reviewed. So
Okay.
that gives a search strategy, and then you will, I suppose, further refine that, and articles that meet your inclusion criteria will be assessed, and the data or the outcomes that you're looking at from those studies will be extracted and charted and summarized. So that's a pretty good summary of what it was, or how I went about it.
Okay. So it sounds like a lot of work.
It
And,
is
and
intensive. I guess the thing is that the evidence synthesis such as that are often done by more than one person. It's often recommended that more than one person do it. They can be done by a team, so it can be quite um intensive time wise, because you could be getting a hit of 10, 15,000 articles that you have to
yeah.
sift through to find your articles that are meeting your inclusion criteria. So it can take a little bit of time, yeah.
Yeah, I think it was when I became aware of your study, I was like immediately very happy for it because I was just so glad that somebody took on the task and started doing this.
Yeah,
It's
I think,
really much
I
much
guess,
needed.
yes, but I think deliberate practice is still relatively in its infancy as
Yeah,
applied to psychotherapy as such. So that the task wasn't too um it wasn't too time consuming. Let's say if you were to do it, let's say on something like CBT, you'd have a lot more articles to include. So from that perspective, it wasn't so bad for me. I think as the field progresses, further studies can be done. They're starting to. I think there's more studies starting to come out now year on year than probably previously. So it's DP is gathering a little pace. But
yeah,
as with any intervention or area, it does take time. So I suspect in the years coming, at least in the last decade, there'll be a lot more available single studies to do, probably a more comprehensive piece of research on that.
yeah. I know that a lot of interesting projects are going on in the world as we speak. Also here in Norway, we have a big study in its early phase, and I'm really looking forward to see where that goes. But also, like, can you give us a general? We start off with a really general overview of what kind of evidence we have on DP in the acquisition of psychotherapy skills.
Yeah, I think as it stands, there is probably there's at least one study now in most areas, I would suspect. I know you folks, Tony and Alexandra Vaz, and you guys have do a lot with applying it to different kind of modalities and from books and perspective. Outside of that, I think if you look at the empirical studies or any of the randomized control trials that have been used over the last several years, it's being applied to a host of psychotherapy processes, from the alliance and empathy, ethics, resistance, and various other different kind of processes that would go along with psychotherapy, such as assessment and consultation. So there'll be almost a study in generally almost every aspect of psychotherapy at this stage, at least one, I would say, or if not, we're not far off it at the moment.
Mm, mm. So both in the modalities and also discrete skills, like psychotherapy skills.
Yeah, skills and
And
processes. Absolutely. So you've empathy, you have alliance building, you have ethics, you have assessment, consultation, general micro skills as well. So it is starting to it's starting to build,
great,
thankfully.
great. It's exciting. So I'm wondering also, when you were reviewing this literature, what were your most important observations?
Yeah, but that's a very interesting and pertinent question. I would think, Victor, and I think I suppose what of interest and my observations, I think they're still relevant. I think maybe one of the, not one, yeah, one of the main issues, let us call it, and it's something that happens early on in research as well, that things are working themselves out. So what is the definition of deliberate practice, or what should be the definition of deliberate practice? What should its key features be? What are its key characteristics as applied specifically
Yeah.
to counselors and psychotherapists? Should that be should it be the same as Erickson's initial definitions? Does that hold up for psychotherapy? Does it make it more difficult for psychotherapists to engage in deliberate practice if those standards are to be maintained?
Mm.
I know a lot of the research is coming from study on expertise in various different fields.
Mm.
Is a psychotherapist engaging in deliberate practice? Is that equivalent, let's say, to someone who has learned the violin?
Mm.
These are the questions that we're still grappling with, I suppose, and that would be one of the main observations that I had, is that the definition of deliberate practice may or may not be a little bit different for counselling and psychotherapy, and it's probably important to trash that out and to disseminate it into the field as a whole, I think.
So, can you say something more about that? What do you mean by that? Is it the questions about the generalizability from violin, sports, and chess and over to psychotherapy? Was that one of your main observations, or did I
Yeah,
get it right
well,
there?
I think that is a good observation. So let's say a violin player, or let's even say an athlete, because there's been a lot done on athletes and deliberate practice. So if we were maybe to use an analogy of a 100-meter sprinter, so a 100-meter sprinter, they will train and they will get feedback off their coach, and their outcome, let's say, is how quickly they can run a 100-meter sprint. And I suppose the variable that they use to assess that would be maybe a stopwatch.
Mm.
So a sprinter, through training and maybe through diet and through intense coaching, can, I suppose, measure their progress on a 100-meter sprint by the stopwatch. So let's say they break from 9.7 and they improve by, let's say, 1/100th of a second to 9.6. Okay, that's just an analogy. The sprinter is generally competing against herself.
Mm.
So I suppose the main difference here being is that psychotherapy, the other variables are, I suppose, so complex, because you're looking at different people sitting in front of you,
Yeah.
and you're I suppose you are assessing your expertise and your development based on how the client also impacts that. Okay, so they're also a variable within that. So it may not be so straightforward. I guess then we bring in the idea of measurement as well. So I guess the other piece, probably one of the other main observations from the research, and sorry to go on a tangent or to digress, is that there seems to be two main ways that deliberate practice would be used as such. So one would be in the acquisition of therapy skills, which obviously
Mm.
the scope and review was largely about. But the other is about then, well, how do you actually go about measuring progress? And that would then, I suppose, bring in the idea of routine outcome measuring and using outcome measures to track if you're actually making progress
Mm.
from deliberate practice exercises,
Mm.
if that makes sense.
Mm. So the studies that you looked at, did they look at more at the therapist's behavior after a learning intervention,
Um,
more that than the outcome?
Yeah, so it was almost exclusively looking at learning a host of therapy skills, however they were defined in the study. There's very actually, I suppose and that leads in maybe to the other observation, is that really there is, while we can identify that there's a lot of different variables that have correlations with outcomes
Yeah.
in psychotherapy, and it might be important to align your deliberate practice process to some of those.
Mm.
It remains that there's very scant, little to no evidence or at least from a randomized experiential kind of perspective, that deliberate practice improves outcomes in that way. I think Daryl Chow's 2015 study was probably one of the only ones, or one of the very, very limited few that I'm aware of, that looked at it from an outcome perspective. But that wasn't a randomized control trial. So obviously there is some inherent limitations there in
Yeah.
drawing generalizability from that. So I still, yeah, that is an area that the field may need to look at going forward.
Yeah. Did you find variations within definitions of DP?
I think so, yes. I would say overall, most of the definitions would include or be inclusive of at least two or three what would probably may be considered main aspects. So like, for example, I know Daryl Chow and Scott Miller may define it in a little bit of a different way. There'll be 4 or 5 steps. I think if I was to maybe talk about possibly 3 main features or characteristics of DP, and what is it? So I think one would be repetition.
Yeah.
Repetition would seem to be absolutely essential. Procedural learning. So we differentiate the procedural from the conceptual, as you all, I'm sure everyone on the call knows. And so conceptual would be maybe some of our traditional methods of teaching or training psychotherapists. So it may include reading lectures, didactic lectures, case study, reflective practice, and they're all needed. So I think one of the important things perhaps to allude to is that deliberate practice is not necessarily instead of these other important factors that we need: reading books,
Mm.
you know, watching videos, attending case studies, and so on and so forth. They're all important, but they're generally considered conceptual learning. So the
Mm.
deliberate practice, I suppose, would again differentiate because there's a focus on procedural.
Mm.
So procedural learning, repetition, and feedback. I'm
Yeah.
thinking maybe there may be the three from memory, the three areas that would be considered in most definitions of deliberate practice. Now, some may expand on that further. And I suppose it does bring up the question then to, well, how are we linking that to outcome? I think that's probably
Mm.
another question in itself. But those 3 areas seem to be particularly important.
Mm. Mm. Also, I think it's very interesting that you emphasize the importance of theory and conceptual learning. I think what's when I got acquainted with deliberate practice some years ago, I thought of it initially. I thought of it as something being a little bit in opposition to all the conceptual learning that I was dissatisfied with in my development as a therapist, right? And when I started reading Erickson, I found it very interesting to read how he talks about mental representations as
Mhm.
a schema in the performer that has procedural parts and conceptual parts and conditional parts. And I think that was I got the impression that this was a huge interest of his to describe these mental representations that consist of many modalities of knowledge. Yeah, but we have been lacking the procedural training,
Yes,
training of the procedural part.
I would tend to agree with you. I think maybe you can't really do the procedural unless you have some type of conceptual schema about
I
what
agree.
it is you're trying to do and how you're trying to get there. I think the procedural, along with feedback and the repetition, can really help you hone that by maybe breaking it down into discrete steps.
Yeah,
You have the mental repetition, what it is I'm trying to do and where I'm trying to go with that. But you will find that when you're first learning that, you may be fumbling, you may stutter a little, you may get
yeah.
nervous, you may withdraw and avoid those uncomfortable feelings.
Mm,
But I think, and that's maybe where the DP comes in, that's different from maybe some of the other learning or how lecturers or continuous education goes about doing things, because you're setting a path that can be that you can use repetition with to actually really hone those skills.
yeah,
Whereas maybe in a traditional training setting, you may get some broad generalized feedback in a triad or a dyad or of a lecture, and then you move on maybe to something else, where with DP that repetition is coming in and you're really getting to hone a skill, which then can be incorporated into the conceptual schema, and you have a way of viewing similar situations that can be generalized to it, if that makes sense. And that's my take. That's a recent kind of insight that I've had. So
Yeah.
whether that holds up, I don't know, but it would be interesting.
And also, I think it's very fascinating to see how the procedural learning it feedbacks to the theoretical knowledge. It sheds light over the theory that you have previously learned and gives things foreground and background. It's helpful also for the theory part. Mm.
Absolutely. I think just another, I suppose, observation that I had is from DP is, I suppose, how it's happening, where
Yeah,
it's happening, and how it's happening. And um, a lot of, from the research perspective, at least, it was all happening in control trials or university settings. There has been really very little to any research
yeah,
kind of outside of that. I think there may be initially one or two studies now that have been published. So maybe looking at what's happening in naturalistic settings, and I suppose what you guys there are doing, capturing how that's going about, some studies on that would be very helpful as well.
mm,
Um, I know then the kind of the system of how DP is being how people are being trained in it. The role of technology was another kind of big, not big finding as such, but how people are engaging in solitary. That's actually another very important thing. Actually, people engaging in solitary practice and
yeah,
maybe use video prompts or stimulus to do that. But what are the ramifications there for feedback?
mm,
If they take a little bit longer. So that's another important thing. Whereas um yes, so using video stimuli to practice in isolation, and it's something I'd done when I was training people, and in myself, I'd, in the first instance, they'd be behind the laptop on their own practicing those skills.
mm,
But the feedback, it's hard to kind of find the zone of proximal development if a person's on their own. Now I know there's the scale, or the scale that you guys use, which is very helpful, but it would be interesting. I suppose it's interesting to maybe see or understand further what is the best way to receive feedback and when. So
mm.
there's ramifications, I suppose, for deliberate practice, if it's done in isolation or solitary versus in some type of live dyad or triad where
Yeah,
people are more engaged.
yeah, yeah. I think also the solitary work, well, at least in my experience, it has to be connected to a feedback situation in a way. That you do it, you do the solitary work, but you do stuff that you picked up in supervision or in, yeah. So you have kind of the goals that you have from supervision, you put that into the solitary practice, but you lack the feedback of during practice. That's true.
Yeah,
Good.
the refinement piece, I guess.
Yeah.
I've I've just finished up a small qualitative study with a group of practitioners who are engaging in naturalistic settings in a couple of different countries now. It's very small. I think it's probably possibly one of the first qualitative studies on DP.
Yeah.
Certainly with people outside university or experiential kind of control trial settings.
To be published pretty soon, right?
Yes, I have just literally today sent it back off to the publisher. It's the same publisher as the scope and review, so the Journal Council on Psychotherapy Research. So it should be up on their site in the next week, I would imagine, at the latest.
Great.
And it was really interesting as well. Insofar as I guess maybe one of the, not to say too much on it at the moment, but one of the kind of main findings, as it were, and again, it's a really small study, so it needs to be kind of looked at in context, is that there's a lot of, I think, can be a lot of shame attached to learning a lot of these skills. It can cause practitioners to actually feel very distressed,
Yeah.
anxiety, they can kind of, feel bad about themselves,
Yeah.
about their efficacy and their competency. So using deliberate practice, I guess it's important to do it, be tentative and be very supportive, and for supervisors or anyone delivering the training. Something that might actually prove helpful is doing those solitary exercises, maybe on video prompts in solitary prior to going into a classroom setting or to a training setting, where at least the person may have developed some level of competency
Yeah.
uh, in attaining those skills, and that could possibly maybe take some of the anxiety or shame and so forth out of it. So yes, I think we still quite a way to go from a research perspective, but I
Mm.
also suspect that a lot of the stuff that's happening out there on the ground is leading the way
Yeah.
anyway, and maybe research needs to catch up with that a little bit as opposed to the other way around, as we sometimes like to do things.
Yeah. Yeah. It's sometimes you say stuff that I would like to pick up on, but I know it's not an interview. I'm not interviewing myself, but if I need to comment something. But I think this is
Right.
a key point for the DP supervisor to be able to provide a safe learning environment, because it is anxiety provoking to go outside the comfort zone.
Yes.
I remember very vividly when my very early experience in DP supervision, when my supervisor told me that yeah, he made an issue out of this self-criticism that I was sharing with him,
Mhm.
and he made an issue out of well, he told me that you don't know what you don't know, and welcome to the club of lifelong learners, right? I think
Absolutely. Yeah.
I think that was really, really unshaming, and I think it's really important for us to remember how good we are used to be. We are in job interviews. We do difficult stuff in our clinics. We have to kind of maintain the image of ourselves as the people who know what we are doing. And now in this approach for learning, we need
Yeah.
to kind of face our failures instead and meet them with interest and like opportunities in an unshaming way. And that's
This
really it's a change of culture, I think.
It's a change of mindset. It's a change of culture. It's a change of maybe the medical model way of having a hierarchy that you learn maybe diagnosis through DSM and so on and so forth. And that, I suppose, maybe gives you a certain level of expertise. And I guess it's about understanding that, I suppose, psychotherapy is much more nuanced than that. There's so many different variables and concepts that can impact on an outcome.
Mm,
And we probably, most of us did not actually probably get trained well enough in those, if we managed to actually learn them at all. So I
mm,
think that can be quite humbling if we realize that, but it can also then bring up a certain level of conflict within ourselves when we need to feel well we're professional, and we, you may have trained for 10 years and then you went through a accreditation period and so on and so forth. So as you say, that mindset shift, whether you want to call it a growth mindset,
mm,
being passionate with yourself.
mm.
Again, that's another really important thing. Self-compassion, bringing
Yeah,
that into the DP process, whether you want to do that through self-compassion or mindfulness or whatever, I suppose, repertoire of skills that you like to use. That seems to be really important as well, and something that should be actually a core part of deliberate practice. So it's
yeah.
not just about maybe the skills and learning and procedure, but it's
Mm.
also about that self-care, personal development piece attached to the identity that we have as practitioners, if that makes sense.
Yeah, it makes sense. And I also think that the supervisors need to model this, and colleagues and supervisors, they need to model this.
Absolutely. Sorry,
Uh,
just on that point, there is a I don't think I'll remember it verbatim, but I do have a quote from the qualitative study that's
yeah,
coming, and it's about the supervisor, and it's about one of the participants speaking about feeling really, really hurt when a
yeah,
supervisor said you didn't do that correctly.
yeah,
So that, that's the level that we're dealing with. And I think the other key piece was that also, again, if we're to look at maybe analogies of DP and the definition, and there was an actually great quote that I was going to use to name the article. It was something along the lines of, well, it's not like learning a guitar.
mm,
I question myself about, what I had done or what mistakes I made with this really suicidal client.
yeah,
So, we can kind of see there's a lot of emotion vested in it where that may not be there with maybe chess or violin or
yeah,
so on and so forth. So it does bring certain other kind of variables into play that aren't considered in deliberate practice when it's applied to those other areas or contexts.
yeah. It's an analogy with limitations. Yeah,
Absolutely.
But if we go back a little bit to, I mean, I just noticed that the time flies, and I need to make sure to get to the to some more of the questions. If we
Yes.
go back a little bit to the key ingredients of deliberate practice, where definition of DP among studies varies a little bit, uh,
Yes.
a lot. And also one thing that I found, I think you describe it also. Nurse and colleagues describes it that that one of the differences is is that in some studies the tailoring of the practice is
Mm.
included. So they find a way to tailor the repetitions to the practitioner, the therapist's zone of proximal development.
Yes.
In other studies, you don't have this quality. How important is this tailoring, do you think?
Oh, well, there's another key thing. And
Yeah.
maybe I've said there's three maybe core features or characteristics of DB of deliberate practice. I was about to call it DBT there. um, but I think possibly maybe there should be four, because
Yeah.
zone of proximal development is absolutely essential, wouldn't you say? Because why would we want to learn something that we're already really, really good at or really, really proficient at? We want to be looking at, I suppose, our growth edges. So again, for DBT, you want to be doing something that is on the edge of your development. So we can really only do that by identifying where we are currently at with it. And I think that's probably one of the reasons why it can be a little bit more maybe difficult to do DP in a group setting
Yeah.
than with individual people, because that you're looking at how do I go about tailoring feedback to a group's zone of proximal development. Now you can use the group itself maybe to do some of that, but it becomes more difficult to achieve that. So let's say there is, I think on my book last year on evidence-based counseling and psychotherapy, I provide um a table at the end of the book with various different psychotherapy variables, um, process, relationship, client variables, and let's say treatment methods, and looking at the effect size or how effective they are, the correlations with client outcome.
Mm.
So I guess intuitively it may make sense to aim at the variables that have the biggest effect sizes. So maybe goal consensus, emotional experience in alliance, and so on and so forth. Um, but if you're really, really good at that stuff, well, then what's the relative benefit going to be for you, where maybe
Mm.
you're really, let's say, bad at putting structure to a session,
Mm.
or opening your first session,
Mm.
or to maybe meta communication. So you get what I'm saying.
Mm.
That the zone of proximal development is probably really, really important there to come in at a level. I first identify where you need to be heading, what
Mm.
direction, and what level you need to be coming in at. So I think it's essential.
I think what we've there's something that I would like to see research on, and I think that is happening also. Is a peer practice format where we teach people we teach people a very pretty simple tool for difficulty assessment and adjustment, and help people get engaged in peer practice. And when the task becomes too easy or too hard, they know how to make simple adjustment
Yes.
to stay just outside their comfort zones as they practice.
Mhm.
And we try this in groups, and we're just eager to see research on that.
Yes, I'd agree. I'd agree. It's essential. A really
So
important next step.
yeah, so so um um so I think in my last question, I have more, of course, but I would like to let people, if they have questions or comments or thoughts, to have some time for that too. I just want to pick up one sentence from your study that we are talking about. You write uh, you write that however, in psychotherapy, the definition and operationalization of deliberate practice are still open to interpretation.
Yes.
So multiple takes on DP, basically.
Multiple takes on DP. Yes. Yes. And what are the important ingredients or features?
Yeah.
Are some more important than others? If you were to remove one, let's say, would it make a difference? So we don't really have answers to any of these questions. So yes, I think maybe for um let's say education perspective, if students are learning new skills, so you can really apply deliberate practice to any type of psychotherapy process or educational pursuit.
Mm.
And that has been happening. I know Julie McLeod also probably published a really good study of students in training on their master's degree, and looked at the range of different ways that DP could be used and practiced, and it involved peers, and there was different what's the word I use, more knowledgeable other, again, that's taken
Yeah.
from
Yeah.
socio-cultural, like the zone of proximal development. And I
Mm.
think maybe keeping it open,
Yeah.
keeping the definition open so that it's more inclusive,
Yeah.
because it can be quite an elite idea, that you have to really work hard and you have to follow these exact steps and you have to do it for this long. And I think that's just probably not the way to go, because it excludes a lot of people who are busy, like students. Even if you're working full time and studying part time and you have a family and like deliberate, I think one of the really important things about any type of evidence-based program or intervention, let's call it for argument's sake,
Mm.
is that it can be adapted to context and from an implementation perspective, because you can have something that has the best gold standard evidence, but if it's just not practical to
Yeah.
do, well, then the uptake of it is going to be very, very low. So from
Yeah.
an
Yeah.
implementation science perspective, at least, which is another area of interest for me, is that kind of keeping it, being able to adapt it to a specific context, maybe more important than, having fidelity to all these kind of really descriptive steps.
I think, yeah. Again, I mean, I think this you pick up on a extremely important point, because, well, especially because so much of the foundation for DP in psychotherapy is derived from the science of expertise, right? Which
Yeah.
is it's a study of Olympic extreme performers, right?
Yes.
And an artifact of that would be for us also to put the bar there, that we will want to become Olympic. And yeah, but if we can change or improve procedural learning for all at any level, I think we will be better off as a field and
Absolutely.
population.
Absolutely. I think, there may be there's a few kind of outliers among us that will be really, really good and have huge effect sizes, but we're generally speaking, we're all average. Most of us are average. And so what can deliberate practice do for the average practitioner? And
Yeah,
that's really where we should be, one of the areas where we should be looking, at least what can deliberate practice do for the average practitioner. The elite people who are outliers, they're going to get there eventually. You're probably doing deliberate practice in some way, shape, or form anyway before any of us were speaking about it. Their motivation, their mindset, the amount of time they've spent obsessing about theories and practicing and so on and so forth. So I think I really think the procedural learning with repetition, feedback, and identifying your growth edges, it's a really good general way of doing deliberate practice, irrespective of what type of psychotherapy skill or process you're trying to become more proficient at.
yeah, yeah. So I'd like to ask you one last question and then open for questions. This is a pretty broad one, but I mean, you've been systematically reviewing the evidence as it is now. What do you think is the most important things to look at in future DP research?
Oh, that's a good question. I think maybe I think context is really, really important. First of all, I really think, we need these type of questions really need to be considered in the context of what it is we're
Mm,
looking at.
mm,
I think some more replication studies are
yeah,
important.
mm,
I think replication studies that are conducted quite well will
mm,
start adding to the existing body of research, and then a more comprehensive systematic review and meta-analysis can be conducted. So I would say that's really, really important. From the training perspective, again, the studies, the existing studies that are out there in the randomized control trial, there's a lot of heterogeneity within those studies. So what is it that they're actually doing? How are people being prepared for the study or for the intervention? And what type of feedback, what the extent of feedback they're getting, are they identifying people's zone of proximal development, and so on and so forth. So that would be important. I think on a broader level, there's also, I think, questions around I suppose the so what question. So I think maybe that's for learning a host of skills in training settings. That type of research would seem to be quite important. I think for maybe people who are outside of training and workshop settings. So, what is the impact of deliberate practice there? How is it being conducted? And we know very little about that, to be fair, from a research perspective. And then one of the big questions attached to that is then, what is the effectiveness of this? So is your effort in deliberate practice producing outcomes for your client? And that's the really crucial question there. I think I know there's a lot of ideas around time spent practicing. That I'm not a big fan on that. Time spent practicing, yes, if you're actually practicing the right thing that you need for your zone of development. So I could be doing 10 hours practice DP outside of everything a week, but well, where am I aiming that? Is it beneficial? So one of the ways then, I suppose, we can look at that in certain types of studies, if they're conducted quite well, is to look at your outcome data. So your measures, your Q45 and Acorn and Fit and ROM and stuff. And we've been doing it. Published a couple of studies this year, in fact, on the Alliance and how we can kind of go about actually using that through deliberate practice. It wasn't a deliberate practice study, but it was on the Alliance. I think we like one study with 150,000 clients among loads of different psychotherapy clinics, and looking at the correlation of the Alliance on outcome. So that those type of studies would be important for aggregating your data. So is your effect size moving up from, let's say, 0.7 to 0.8? Is that meaningful based on on the amount of effort you're putting in? So is it is an effect size of 0.1 after all that effort and training, etc., actually worth it on an aggregate level of your data on your client caseload? So they're the other types of questions that could be asked. But and I'll finish up on this. I know we're probably stuck for time. Is that DP is a very beneficial way of training, for starting off your training. So, and it's probably best that you can do that at the very kind of early days of your psychotherapy or psychology training. So I suppose the more it's embedded into the curriculum and the way of the philosophy of teaching in universities, the better, because it regardless of, I know NORS, that the recent systematic review by NORS, etc., and I think it probably included most of the studies that I looked at. Yes, there was questions around quality of study, but that's often how it influences bias. But I think the evidence is very, very clear and suggestive that learning skills in this way is helpful over and beyond maybe some of the other methods of doing that.
Yeah, great. Okay, Daryl. So in the last, thank you so much for that comment. Also, it's but I think also I'd like to open the floor for a few questions. If there's any among the audience who have questions or comments or thoughts about what we have been discussing.
If that's okay, I might jump in.
Yeah.
I want to just first, I know we're almost about out of time, so I want to first really give a heartfelt thank you to Daryl for doing the work and keep on doing it because it is so important, for it to not become a guru-based thing, this whole lore practice hype that's starting to come up. It's so great to have the research, especially research pointing out the limitations. I so appreciate Daryl pointing out, potential problems, limitations, lack of data. I put on the Zoom chat a list of DP research for counseling and therapy because I think we want to keep track of those. And I just want to add to what the conversation you had between Daryl and Vidar, that I think we're about at a turning point. We're going to be talking more about the limitations and difficulties about implementation. So not just the lore practice and studying the lore practice itself, but in my experience doing a bunch of DP workshops at this point, most people, of course, it's a very sampled biased, agree with it and like it, but the difficulty is then implementing it, right? In their counseling center, in their university setting, it's actually very hard to do it, even if people do agree with it. So I think that's kind of the next wave of studies and brainstorming together as a team, all of us here. That's it.
Excellent. Okay, so if anybody, yeah, Karen.
Yeah, hi. Thank you so much, Daryl. And I also would like to just emphasize on the comment that Alexandra also had, that we need to focus also on the research on learning processes and how to implement into the competence development in organizations. But I was just, maybe we're over time, but I was just interested in like outcome measures, Daryl. You're talking about like outcome as fit and therapeutic alliance. But I'm also interested in like more of, we have the FIS, the facilitative interpersonal skills. But I think it's difficult to do research because it's difficult to find the right outcome measures to effectively evaluate the effect, if you know what I mean. So would you like to say something about that?
Yeah, well, it's a very good observation. I guess first of all, I know that the fizz measure, it's Anderson's, isn't it? I
Yeah.
believe that's good for the facilitative interpersonal skills, and I guess something like that can be one component of deliberate practice. I think as well as maybe looking at the implementation of it, of DP going forward, well, developing some type of protocol would seem to be important as well. But how do you go about actually getting one of those measures together? So about designing it. So what's the reliability and the validity of such a measure? I seen a survey going around last week. I can't think of who it was. It was a author who was published on DP, but they're looking at maybe developing some type of questionnaire that could be helpful for something along the lines of that. I do think if someone is undertaking such research, a Delphi study would actually be very, very helpful as well. A Delphi study would actually probably nail down that if there was enough people who know about deliberate practice to actually kind of influence and input into that. I think there's a good way of getting a refined measure there that can be used for further research. So yes, it's exciting if you're interested in this research and willing to get involved with it. But there's some maybe the future directions that research can head, and that may ultimately prove beneficial.
Also, I'd like to comment just a final comment that we are many people around the world who are very interested in this, and some of us are doing research on DP, and I really strongly want to encourage us to stay in touch and to share our approaches to DP and to share ideas and to discuss them, and because we are many people working on making this well, Erickson's findings into something specific for therapists, and it's good to pool ideas. So I just strongly want to once more encourage you to join the activities of the International DP Society, because this is what we are about. and a lot of people there are interested and into research on this. Okay, I am respectful of time, or I'm not. Maybe I'm not, because we're over time now. But so I just want to wrap this meeting up. It's been really, really great to talk to you, Daryl. And I also, like Alexandra Vaz says, I want to thank you for the incredible amount of work that you've been doing for the field. I think it's really great. And also, I think we landed on a very nice point when you said that yeah, we need to make DP something else than an elite idea, right? Something something that is as easy as possible to engage in. Yeah. So I will just want to thank you all for attending, and with that, I bid you goodbye.